My name is Azza Karam, and I serve Religions for Peace. Religions for Peace is an international, non-governmental organization. Like the UN has government members, Religions for Peace has religious institutions as members. All religious institutions representing all the faiths of the world, including indigenous peoples. This is the constituency of the organization that I serve since March of this year. HIV and AIDS has taught us, perhaps more than any other disease and public health calamity, it has taught us that we cannot work in silos in any particular space. That in order to build the fundamental resilience required at an individual, communal, national, or global level, we have no choice but to connect with one another on every single possible level, to be learned, to be strategic, and to be engaged. COVID-19 is actually benefiting from those experiences and the lessons that have been learned through the HIV and AIDS space. Why? In many ways, but primarily because, and the interim Ebola crisis was also deeply instructive based on what had happened in the HIV and AIDS space. One of the many lessons we're learning here is that religious communities are integral to the care and to the response and to the policy implications, to the resilience, and especially to the renewal of life, lives, communities, and policies, public health policies. You cannot respond to HIV and AIDS without public health policies, which in turn impacts on the way politicians, political parties, medical health professionals, the general public establishment becomes involved in that very integral response that is required to HIV and AIDS. At a minimum, we have realized that none of us, in whatever sphere of space of public policy, none of us can operate on a public health issue without engaging the religious actors. Religions today are understood not only in the realm of the sacred within, but religions today are very much what you engage on and engage with institutionally. Therefore, the HIV and AIDS response and the resilience to it requires the resilience and the renewal of religious institutions and religious partnerships. The multi-religious response has to be what will frame, enable, or disable and deconstruct the responses and the resilience required to build the responses to HIV and AIDS. If we break up as we are today, if we each work as religious organizations in our own respective silos, the Christian with the Christian, the ecumenical with the ecumenical, the Muslim with the Muslim, the Hindu with the Hindu, it's brilliant that all of these religious actors are each working in this space. It is absolutely necessary, as I said before. But the resilience and renewal in our response and understanding and behavior and every single policy implication required to deal with HIV and AIDS, which has gone nowhere, requires us to work across our institutional silos. And that applies to the so-called secular and the religious. It applies especially when we talk about multi-religious collaboration. Religions for Peace has 90 interreligious councils in 90 countries. National platforms which bring together the religious leaders representing the religious institutions and communities. Each of these has women of faith and youth networks. One of the lessons learned from COVID is that we don't necessarily come together across our religious and institutional spaces easily. The religious responses to the COVID-19 disaster shown us that religions are, de facto and de jure, the ones responding foremost, most, and sometimes very well, sometimes as good as, if not better, than government-run health spaces and services. Religious institutions respond, and they respond amazingly. But we don't respond together. We don't come together to serve the very same communities. We set up a humanitarian, multi-religious humanitarian fund in March itself as Religions for Peace. We didn't intend this to be a Religions for Peace fund. We intended it to be a space where the different religious actors, institutions can come together to serve together, but be deliberate about one thing, not about the service because we're doing that anyway, but be deliberate about working together to serve together as multi-religious actors in the same countries, in the same spaces, in the same communities, requiring exactly the same kinds of things, whether it's medication, whether it's actual food, whether it's just support or somebody to sit with someone and spend some time with them, to look after them. We're serving the same communities, suffering the same things all over the world. Can we be more deliberate about working together, coming together, pooling our resources, human, financial, in kind, it doesn't matter. Let's just be deliberate at making sure that we actually come together to serve together. It's not happening. So we found ourselves landed with a fund that needs to be dispersed to those who are trying to work together. And there are some good examples. At the national level, sometimes it is easier to get the different religious communities to work together. But it isn't an automatic response. It has to be engendered. It has to be encouraged. In some cases, it has to be paid for. So each community devotes the little that it has or the much that it has, depending on the community or the organization, to its own efforts. For the multi-religious, you kind of have to pay more. And that's sad, but it's true. And it shows us that we still have a ways to go, that resilience and renewal actually will translate into resilience in persevering to be working together, in the determination to work together in spite of the differences. The resilience that has to be enabled at a personal, individual level, at a community level, at an institutional level, requires a determination to work across and with our differences. And that is the renewal. We will renew the faith that we each hold dear to our heart. We will renew the services that need to be provided. We will renew the policies that need to be implemented when we work together in a determined, deliberate way. It doesn't happen automatically. Renewal and resilience are both part of the same equation. In order to remain resolute, in order to remain determined, we have to renew. Our faith is renewed in the encounter with one another. Our ability to serve communities is enabled and renewed when we continue to serve together. Yes, we will achieve plenty when the Christians work on their own, when the Muslims work on their own, when the Jews work on their own, when the Hindus and the Buddhists and that. Of course we will. We are achieving plenty. People are being served. We don't say that religious institutions are the first responders in humanitarian crises for nothing. It is because they are. But imagine what it would be like if we could work together across our differences determinedly. Work together to serve together. Imagine how difficult it will be for certain people from within the same religious communities who have opinions that are, shall we say, somewhat different about the rights and obligations and duties that are inherent to service. Imagine what it would be like if they see not one organization, but many coming together on the same rights, committed to the same principles to serve everyone. Imagine how difficult it would be to break that bond. Imagine how difficult it would be for any detractor who is against focusing on HIV these days. Imagine how difficult it would be if they see us all working together in a determined fashion in this space. Imagine how difficult it would be for governments to ignore. One government, many governments. Imagine how difficult it would be for the pharmaceutical industry to impose. Imagine how difficult it would be if we work together for anything to stand in our pace. And imagine what kind of faith that will inspire. Even our own faith, imagine what working together can actually build in terms of resilience and renewal, even in and of our own faith traditions. Multi-religious is not an option. Working multi-religiously is an absolute requirement to face the spaces that we will be facing more and more. It will be one humanitarian issue after the other. We owe ourselves a collective awareness that HIV and AIDS is not a silo. It is a leader, it is a guide, it is a light on how we behave on public health in general, on how we integrate the religious service spirit into the political, manipulative spaces, and above all, HIV and AIDS must continue to guide how we work multi-religiously with one another to renew the faiths that we have and to commit to the resilience of working together. That's what it means. Be well.